First year. Right. You know what this reminds me of? Remember, we passed a bill, and I'm thankful I voted against it. No Child Left Behind.
I voted no on that too. That was a loser, wasn't it?
And why did we vote no? Because what it did is it put the Department of Education between a parent and their local school and their local administrators. And that thing passed with all of this promise, because the promise was we're not going to leave a single child behind. Well, you and I felt passionately, that's absolutely right. We don't want to leave a child behind, but the way to fix that isn't to put a government bureaucracy in charge of that kid's education. And guess what? We are now 8 years later, and who now agrees with us? A lot of folks on the other side of the aisle, and most of the folks on this side of the aisle who voted for that bill now recognize that No Child Left Behind was a huge mistake, because what it did is it took local control, parental control of your child's education away from parents, away from local administrators, and moved it here to Washington. And we're leaving more kids behind, even though we're spending more money than ever. And if we think, so a lesson from history, from those of us that saw that No Child Left Behind wasn't going to work, this is a monstrosity that is 10 times bigger and 10 times more impact than No Child Left Behind will, because No Child Left Behind only impacted our kids. This will impact every single one of us, and it is the same model of moving away from the concept of freedom, which my colleague talked about earlier, the concept of freedom to raise our kids, freedom to choose our health care, freedom to make our own health care decisions, moving them to federal bureaucracies and bureaucrats who don't know the names of our kids, who don't know the names of our doctors, and who don't know the hospitals that we want to go to. That's the problem with the approach that we are seeing today. The rationing. I think the other thing that, I used to be in the private sector, and I used to be in the marketing world. And we all know that these forecasts, these aren't actual numbers, they're predictions. Right. And one of the things that we have learned from these predictions is that does government forecast conservatively, meaning, if everything goes bad, we're going to be $800 billion short? No, the government forecasts optimistically. I think it's pretty safe to say that if you take a look at the assumptions and the predictions, that the deficit, or the amount that this program will add to the deficit over this period of time, is probably at least double.
Tell me it's not so.
Yeah, it's what CBO is predicting. The other thing that it is based on reimbursements to the states. And to get people in some of the states to buy off on Medicaid reimbursements, what they do is they bump them up in the first 3-4 years of this program, and then they cut them dramatically. And we all know that those cuts will never take place in future years. And so the deficit most likely of this proposal will be significantly higher than the numbers we see today, and I think that's been true for.
But just jump.
The informed gentleman from Louisiana and the gentleman from Michigan.
Yeah, I think we've had some pretty good discussion about. People want to help. This is hard, but what's the real motive for moving this all under a government health care? And the gentlelady from Minnesota helped point out, this moves $250 million into Acorn, because what it does is when you move all of this spending from the private sector to government, we have control. That bureaucracy has control. The president has control to direct policy. And what many of us would think is personal policy. That is between me and my doctor, our family and our doctor, and all of those kinds of things. And what we're doing when we move that amount of money, and remember, we're moving basically 20% of the economy with one vote. We're going to move it from the private sector, where we each have some influence, and we'd all like more control. And that's what the Republican proposals do, is give us more control in that equation. But instead of us having more control, we're going to give it up. Or there are people in here who, the American people, I don't think know they're giving it up. But there are people in this House, in this Senate, and in this town who are willing and want to take it because they want that kind of control over social policy, healthcare policy, economic policy in this country, because they don't trust the American people to make those decisions for themselves. They believe that the economy, they believe that everything begins in Washington. And as Republicans, we know and we believe that it begins with the people at the grassroots. They are the ones that drive America. They are the ones that drive our communities, our states, and our country, not this town and not our state capitals. And that's the fundamental difference. We're uncomfortable taking that responsibility or moving to that responsibility to Washington. We're not only uncomfortable with it, we think it's wrong.
And
my Democrat colleagues think it's right, it's appropriate, and it's necessary.
The gentleman
will
You're
yield.
going to reconstruct the Soviet Union and tell me that.
The gentleman yields. I mean, we know that markets are imperfect and that markets are tough, but that markets correct themselves. And that they do that because people are provided with freedom to innovate and to be creative. I think, one little last lesson from No Child Left Behind. In 2001, when that passed, it said, we're going to measure this year's third graders versus last year's third graders in the same school. And you kind of say, that makes no sense. But, in 2001, that was the measurement tool that they were going to use. It's now 8 years later, and for 8 years, for the last 5 or 6 years, people said, that doesn't make any sense because this group of kids this year could be very different than the group of kids last year. So why measure the performance of those kids? We ought to be able, and we have the tools to measure the individual achievement of every child every year. And that's what we should be measuring. From the first day of school to the last day of school, how much learning took place. But because it's in a bureaucracy, and to change that, we have to pass a law. We have to pass a law through the House and the Senate, and the President has to sign it to change that. So our schools and our local communities are still being judged as being what? They are a failing school. That's the label that the federal government puts on them. A failing school because we are using a failed measurement, which everybody understands is a failed measurement, but we can't change it. In a market system and a market dynamic, it would have changed a long time ago.
Dr. Brown.